Well, welcome everybody. I'm Peter Wayne, and I serve as the Director of Research for the Osher Center for Integrative Medicine. And I have the privilege today of facilitating this next segment of the forum, which we're calling the Poster Synopsis Medley. But before doing that, I just wanted to take a moment to say thank you all for your attendance. This is really remarkable. It's really incredible, and I know you're all busy, and thanks for taking time out of your busy days to join us for this important event. I also wanted to express my gratitude to all the collaborating centers for their participation in helping organizing this, and of course to our sponsors. So the idea for this medley grew out of our broader network vision, which includes not only catalyzing lateral collaborations and interdisciplinary work, but also vertical. We wanted to bring together the junior scientists and give them a voice in this event. And I think these are the new nodes that Dr. Barabasi and Dave King have talked about that are going to come into our network and really spark hubs of new ideas. So towards that end, we had 38 poster submissions, and a small committee picked 12 that we thought were both of very high quality, but also represented the diversity of ideas that are happening across this network of researchers. So in this very high wire act, each of the 12 presenters will be given strictly 1 minute to introduce themselves, to summarize their work, and to entice you to visit their posters so they can share some more ideas about them with you. To ensure that we stay on time, please reserve all your clapping and whistling and cheering to the very end of this segment. So without further delay, I'm going to set up the slides, which are actually on a timer. So this really is a high wire act, and let our presenters share their ideas.
Should I do anything?
Can you guys switch? You're on.
It's counting, but it's not showing.
Houston? Thanks, Matt. Or was it just the connection? So we're going to start all over again. You're on. Oh, never mind.
So a growing number of studies show measurable anatomical differences between the brains of people who practice meditation and those who don't. Even after only 8 weeks of training in mindfulness meditation, changes have been reported in the brain of people who have never meditated before. However, there exist many different types of meditation training, and they may impact the brain differently. So here we conducted a randomized control trial to investigate changes in brain structure after 2 different types of meditation training compared to a third control group. We found that participants who had meditated more during the 8-week training showed a larger increase in size in the hippocampus, an important area for stress regulation, which suggests that meditation training may revert the reduction in volume in the hippocampus found in PTSD, major depression, and other conditions. In addition, participants in the compassion meditation training showed increased cortical thickness in the dorsomedial prefrontal cortex, an area activated during empathy. So overall, our results suggest that different types of meditation training may promote neuroplasticity in different brain networks.
Hi, my name is Bethany Butzer. I'm a postdoctoral research fellow at Brigham and Women's Hospital, Harvard Medical School. My poster is titled Acute Effects of School-Based Yoga on Student Mood, and my collaborators were Satbir Khalsa and Josh Felver. In terms of background, there's research suggesting that adolescents and children experience high levels of stress and psychiatric disorders. And there's also research suggesting that school-based yoga might help with these factors. But no studies to date have examined the acute effects of participating in a single yoga class. So the purpose of the study was to compare the immediate effects of participating in a single yoga class versus a single physical education class on student mood. We had 9th and 10th grade students who completed self-report questionnaires of mood immediately before and after a single yoga class, and then immediately before and after a single phys ed class 1 week later. And we found that yoga provided unique benefits above and beyond physical education on some, but not all, of the mood subscales that we measured. So if you'd like to learn more, you can come and visit me at poster number 3.
Hi, I'm Claudia Fitzgerald, and I'm a research fellow at Harvard School of Public Health. We know from previous study that unhealthy behaviors such as physical inactivity can be related to distress later on. But surprisingly, we don't know if anxiety and depression can affect the likelihood of adopting a healthy lifestyle over time. So we followed 45,000 women over 15 years, and we found that regardless of the initial level of their health behaviors, anxiety and depression was related and had a significant impact on lifestyle later on. We also found that distressed women were 80% less likely to engage in a healthy lifestyle later on, and 20% less likely to maintain their healthy lifestyle if they had one initially. Anxiety has also a stronger effect in older women, while depression has a stronger effect in younger women. So distress may be an important target of prevention for chronic diseases. Thanks.
Hi, my name is Brian Gao. I'm an engineer and I work at the Osher Center. The project I'm presenting on comes from research led by Dr. Peter Wayne, with collaboration from many researchers and institutions in the Harvard Medical School system. Maintaining balance is increasingly appreciated as a complex task with inputs from many different systems. Our study investigated the long and short-term Tai Chi training on postural control and physical function. Specifically, we explore whether newer complexity-based measures of sway that presumably capture moment-to-moment variation and coupling between systems offer additional insights into Tai Chi's effect on the balance, on postural control. Above and beyond what typically is used to study postural control, like sway speed and area. If you come by poster 16, you'll see what I think are pretty interesting results. Thank you.
Hi, everybody. My name is Ronald Garcia from the Martino Center for Biomedical Imaging. Vagus nerve stimulation is an invasive technique that has been approved. Sorry. Okay. Vagus nerve stimulation is an invasive technique that has been approved for the treatment of some cases of clinical depression and also epilepsy. This method has also shown some potential applications for the treatment of chronic pain. However, a high incidence of surgical complications and other adverse events limit its applicability. In the last 10 years, a new technique named transcutaneous vagus nerve stimulation was developed. This technique consists on non-invasive stimulation of the vagus nerve at the auricular branch of the vagus nerve. And results from our laboratory show that the synchronization of this electrical stimulation with respiration could enhance the analgesic effects of this therapy. Because of that, we performed a functional MRI study in migraine patients and evaluated the brainstem response to this technique. Thanks.
Hi, I'm Paula Gardner, and I am the Assistant Director of the Program for Integrative Medicine and Healthcare Disparities. So if you come by poster 13, you can hear more about our Program for Integrative Medicine and Healthcare Disparities. And what we're going to be talking about today is our group visit model, where we have combined 3 paradigms: the mindfulness-based stress reduction, plus integrative techniques such as acupressure and massage, and a medical group visit. And our poster is talking about our qualitative data. There are basically 4 findings from our qualitative data that we wanted to share with you, which was an increase in nutrition and eating habits improvement. Also, that we found that our patients were more aware of the changes in measures in health, such as awareness of their blood pressure and weight, that they were incorporating more physical activity into their life, and also that there was a feeling of not being alone and having less depression because they were being part of a group.
take the extra 10 seconds. I'm Adam Gonzalez. I'm an assistant professor of psychiatry at Stony Brook University. So the study that I'm going to talk about is an uncontrolled clinical effectiveness study evaluating the relaxation response resiliency program, also known as the 3RP. This is a comprehensive mind-body program that was developed at the Benson Henry Institute, specifically and systematically designed to target chronic stress and promote resilience. So this study evaluated 222 patients who were presented to the Benson Henry Institute for treatment. We further categorized the patients into 3 clinical groups based on their primary health concerns, so mental, physical, and comorbid conditions. We were particularly interested in the comorbid conditions since that population tends to be high drivers of healthcare costs, have worse disease states, and poor psychosocial functioning. So in these 2 tables, we present Cohen's d effect sizes, pre and post-treatment changes in mental health and also physical health symptoms. You'll see that across all 3 groups. There were moderate to large effect sizes for the mental health symptoms in all the SCL90 domains, and also differences in an array of physical health symptoms. Thank you.
So hi everyone, my name is Ren Feng. It's my honor to be here today to present the study of Tai Chi treatment for depression among Chinese American patients. The study was primarily conducted by the Depression Clinical Research Center at Mass General Hospital. Regarding there are significant health disparities for mental health care among ethnic minorities, especially for Asian Americans, due to their language barriers and the strong cultural stigma towards mental health disorders such as depression. So we wanted to develop and examine culturally sensitive programs and mental health interventions for this population. Our study finds that Tai Chi intervention was feasible and safe, and it actually helped improve the treatment outcomes of Chinese patients. If you want to know more about our study, please visit my poster, which is number 11. Thank you very much.
Hi, my name is David Vago. I'm an instructor in psychiatry at Brigham. So our study really looked at 2 fundamental questions about meditation. One was, can we explore the relationship between the spectrum of meditation experience and bold activation patterns during an open monitoring meditation? And number 2, we know that when you meditate, you have fluctuations between levels of clarity and levels of mind wandering. So we looked at peak states of clarity during the meditation state. And so here's just a little tidbit. We saw some caudate activity across the meditators, and then there was a really dramatic increase in frontal polar activation that correlated with meditation expertise and a modulation of limbic areas that also correlated with meditation expertise. So come check it out, poster number 35, and I'll tell you more about what we found.
Hi, I'm Lisbeth Berrueta. I work with Dr. Ellen Lanschefing at the Connective Tissue Lab, Osher Center for Integrative Medicine, Brigham and Women's Hospital. We are interested in manual and movement-based therapies such as yoga. We focus on connective tissue physiology and pathology, and its main component, the fibroblasts. And we are intrigued about the molecular basis of fibroblast response to stretching. We have found very exciting evidence that suggests that this response is followed by the activation of an ancestrally conserved signaling cascade involved in controlling cell size and differentiation. We believe this is a homeostatic mechanism orchestrated by the cell in order to preserve connective tissue plasticity. We invite you to visit our poster number 1 to discuss further this result. Thank you.
Hello, my name is McKenna Longacre, and I'm a second-year med student here at HMS, and I'm so honored by this opportunity to share this important information, which is part of an ongoing collaboration at Boston Medical Center's CAM clinic for refugees. As some of you may be aware, BMC is the major point of care for Boston's diverse refugee community, and this inspired us to offer free complementary and alternative medicine treatments to refugees. What we found in this particular study is that when given access to alternative medicine, including acupuncture, not only did our patients experience less pain, but also their need for primary care services significantly decreased. What we saw was a $691 per patient per month decrease in expenditures just relating to primary care services. If you start to think of all the other specialty services that are involved with the treatment of chronic pain, such as orthopedics, surgery, radiology, you can appreciate how important this impact may be. So with this, CAM may not only provide better tools to care for vulnerable populations, but may also decrease the profound cost of caring for vulnerable patients. Thank you.
Hi, I'm Catherine Hall. Pharmacogenomics has expanded our understanding of cardiovascular disease pathophysiology and raised the possibility of truly personalized medicine. COMT is an enzyme that degrades catecholamines and is emerging as an important hub in network medicine with links to both cardiovascular disease and drug metabolism. We recently demonstrated that in the Women's Health Study, a large randomized control study of vitamin E for the prevention of cardiovascular disease in 23,000 women, COMT is associated with the outcomes. As you can see here, in women homozygous for the high-activity COMT enzyme, at the bottom in the dotted black line, they had the lowest incidence of cardiovascular disease. Compared to the women with the low-activity version of the enzyme, they have the highest, which is a solid black line at the top of the graph. When the women with the low-activity enzyme took vitamin E, they had tremendously lower rates of cardiovascular disease, as seen in the solid red line, whereas women who had previously been protected from cardiovascular disease had an increase in rates. This is important for personalized medicine and pharmacogenetics. Thank you.
Well, that was fabulous. Thank you all.